Good morning. My name is Snyder Shall. I have been teaching neuroanatomy since I got my anatomy PhD back in the 80s. I am chair of the department, but for today, I just want to talk about how the different parts of your brain talk to each other and talks to your spinal cord. So we're going to be talking about association fibers, which allows different lobes to be talking to each other. We're going to be talking about commissural fibers for one hemisphere to talk to the other. And we're going to talk about projection fibers, which go from the cortex down to the spinal cord and to the brainstem. So let's get started. We're going to be using a brain that I've removed the cerebellum and the brainstem. We're going to cut off the part of the frontal lobe and the parietal lobe so that you can see the insula that's inside. Okay, so now we can see the top of the temporal lobe, which is where the hearing is, the primary hearing cortex. The insula are those lines that you see inside that crevice that I've made. And then, of course, you have frontal lobe and parietal lobe up here. The pre-central gyrus is going along here. The post-central gyrus is here. Now, the first thing that we're going to do is talk about how the frontal lobe has to talk to the occipital lobe. So the first thing we're going to do is start paring away the cerebral cortex. It looks pretty gross. Obviously, your neurosurgeon is not going to be doing it this way, but we can do it. I'm going to have to put on my glasses so that I can see what I'm pulling. So as you would expect, the superior longitudinal fasciculus are going to be fibers that go across the top and go this way, across the top of the insula. So that's the first bit of association fibers we're going to see. There are also fibers that go from one gyrus to the next gyrus. So they just loop around the corner, around the sulcus. And those are called arcuate fasciculus. Sometimes the superior longitudinal fasciculus also is called an arcuate fasciculus because of its arc shape, going all the way back here. And goes on down into the temporal lobe, curling on back around. In fact, as we look down deep into this area around the temporal lobe, there are fibers that go around that. So even as we bring this further on down, some of the fibers are going around the lateral sulcus into the temporal lobe. And that's important because you need information that's coming from the frontal lobe to be interacting with the hearing and the memory and the smell that's going on in the temporal lobe. Now, if we come on back here a little bit toward the occipital lobe, the occipital lobe is where you have vision going on, whereas the parietal lobe is where most of the sensory integration is going on. So it's important that the occipital lobe also have fibers that can course up here to that parietal lobe, particularly because that's telling you where the what you're seeing is happening. So the vision is coming up here. You've also got hearing that's going up into your temporal lobe. You've got somatosensation that's going into that parietal lobe. Temporal, occipital, and parietal are all communicating with the posterior parietal cortex to help you know where you are in space and what you are seeing. Now, if we start moving forward, kind of spread out the temporal lobe and start paring away at the inferior part underneath the insula, you have an inferior longitudinal fasciculus. and it's actually going from the frontal, or from the occipital lobe to the frontal lobe, so it's occipital frontal fasciculus. But I also want to emphasize, let's see, the thalamus is about right here, and the lateral geniculate nucleus is on the bottom of the thalamus, and that's important for your vision. So vision has come in from the retina, come coursing around through the optic tract, synapsed in that lateral geniculate nucleus, and then it's going to take this course through the temporal lobe. Let's see if we can make it do it. You can begin to see that it's coursing back this way to go to the occipital lobe. Okay. So some of those fibers that you're seeing are coursing forward in what's called its Meyer's loop. That is basically information from one part of your vision and coursing back to the occipital lobe. So those are called the geniculocalcarine fibers. The information is also going to travel from the occipital cortex forward to get to the frontal lobe through that occipital frontal track. Okay, now I'm going to remove the superior longitudinal fasciculus coming off in the track up here, bring it out of here, and I'm going to start taking away the insula. So that we can get down to where the basal nucleus is. So I'm clearing away the extreme capsule, and then the claustrum and the external capsule, till we finally have this flat surface. That is the lateral side of the putamen. The putamen is one of the basal nuclei. We'll get to that later. So we've done the superior longitudinal fasciculus, the occipital frontal fasciculus. We've gotten to the putamen, and that's what's most important to see on the lateral side. So let's turn it around to the middle. There would be another hemisphere over here. We've got this hemisphere, corpus callosum. So remember, this is the posterior part of your brain with the occipital lobe, the frontal lobe. There's your thalamus. There's the midbrain. There's the optic chiasm. The cingulate gyrus is just superior to the corpus callosum. Corpus callosum being one of those callosal, massive callosal fibers that are projecting to the other hemisphere. But within the cingulate gyrus is a cingulum, and it's a big group of fibers coursing from, or picking up fibers from the frontal lobe, the parietal lobe. I'm starting to pull some of them off, and all the way back to the temporal lobe as you go into the parahippocampal gyrus. You can see it's coming all the way around the top there. On this side, you would also see arcuate fibers, if we were to peel away some of this cortex. You would also see arcuate fibers connecting one gyrus to the next. So they just loop around the sulcus right there. Now, if I go ahead and remove the cingulum, what you should begin to see, if we pull up the cingulum, pull it away from there, the fibers that are coming through the corpus callosum are going to be going up into the cortex. So I keep removing these cingulum fibers. It's a pretty thick bundle. So now the fibers are going into the cortex. Just coming on up into there. All right. So now the fibers, rather than going around it, they're coming through the corpus callosum and into the cortex. If I cut off the corpus callosum, and I can see here, this being the thalamus, and there's the interventricular foramen, which connects the lateral ventricle to the third ventricle. And there's the septum pellucidum. So we're going to just cut and the fornix, so we'll talk more in a little while, goes right across the front there. So we're going to cut it, and we're going to just lift off the corpus callosum. So now, what you can see, there's the thalamus sitting in the floor of the lateral ventricle. I'm going to remove a little bit more of the corpus callosum here. There we go. So thalamus is right here, and there's the caudate. Caudate nucleus is another one of the nuclei of the basal nuclei. And you remember we talked about on the other side that the lateral geniculate nucleus is hanging off the back side of the thalamus, so that'd be over here. So that head of the caudate right there is pretty big. We can remove that. There it goes. What I'm looking for now are the fibers that are coming from and going to the thalamus. Remember that you have fibers that are going to be coming up from the spinal cord through the thalamus and then go on up into the cortex, particularly sensory fibers. So they're going up that way. So those would be the thalamico-cortical fibers. And then as we go further into here, now we start having the projection fibers, the corona radiata, that are the fibers coming from the motor cortex and becoming corticospinal fibers. So if now we've got, here's the thalamus, and now we have the internal capsule right here. The frontopontine fibers going through, the corticobulbar fibers coming on through here. Remember, they're going through the genua of the internal capsule. The corticospinal fibers are going to be coming from the primary motor cortex and coursing through the posterior limb of the internal capsule and coursing on down through the midbrain and on into the brainstem. The rest of the cortex is also going to be coming from the parietal lobe, so parieto-pontine fibers, occipital-pontine fibers, and temporal-pontine fibers are also going to go through the posterior limb of the internal capsule. You can kind of see those kind of coursing this direction because they've all got to come through this internal capsule right there. If we were to remove the thalamus, we might see that a little bit better. So taking out the thalamus. There's the midbrain. So everybody's trying to go down through the cerebral peduncles, which are right there. So they're going that direction. There it goes. So you can see them coursing through there, going toward that, the cerebral peduncle, and then go on down to the spinal cord. Okay, so now we've finished bringing all those corticospinal and corticobulbar and all the corticopontine fibers down through that internal capsule and into the midbrain to continue on down the brainstem. To review all those pieces, You can look at the model of the brain. We've removed the hemispheres. We looked at the lateral side of the brain, saw the superior longitudinal fasciculus going across the top. There's the insula going across the top. The occipital frontal fasciculus went along the bottom. There was an uncinate fasciculus that went around the corner of the lateral sulcus. We then removed the insula, the outside of the insula, so that we could then come down to where the putamen was. The internal capsule was right here. You saw where the lateral ventricle was. In the internal capsule had fibers coming from the frontal lobe, parietal lobe, occipital lobe, and temporal lobe. So when you think about the parts of the brain and you think about your patient with a traumatic brain injury or with a stroke, it's not just a matter of what lobe has been affected, but how the brain talks and communicates with the different parts. It's important to consider all of those pieces.